Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. We have a new episode today and I will be talking about type 2 diabetes. Yes, the ABCs of type 2 diabetes or type 2 diabetes for dummies. Alright, let us get started. We have to first talk about type 2 diabetes and we need to explain what it is. Type 2 diabetes is a very chronic condition. It affects the way our bodies metabolize sugar. Sugar is also known as glucose, and it's an important source of fuel for our bodies. So yes, glucose and sugar will be used in this episode. So with type 2 diabetes, there are two things that may happen, right? So we do have insulin resistance. Right? We have insulin resistance, which means that your body either resists the effects of insulin. And for people that do not know, insulin is a hormone that regulates the movement of sugar into cells. All right? Another thing that could happen in type 2 diabetes is that your body does not produce enough insulin to maintain normal glucose levels. Alright, so it's either you have insulin resistance or your body does not produce enough insulin to maintain normal glucose levels. So, a lot of people think that type 2 diabetes is an adult disease. It used to be known as adult onset diabetes, and then type 1 diabetes used to be known as juvenile diabetes. Unfortunately, now things have changed. We've seen more and more children being diagnosed with type 2 diabetes. Yes, so we are seeing type 2 diabetes in younger people. So it's not only adults that have type 2 diabetes like in the past, unfortunately. Alright, so as I said before, blood sugar is also known as blood glucose, and it's very important when we talk about diabetes because without blood sugar and blood glucose, there's no diabetes. So, and we have to talk about both of them, or blood sugar or blood glucose, because it's important in diabetes management. Very important in diabetes management. So, and the reason why we talk about blood sugar or blood glucose is because many foods break down into blood sugar. Yes, I tell people, most of the things that we eat, they break down into blood sugar. They break down into sugar. And the sugar is used for energy to fuel our brain, our muscles, our heart. So it's important to talk about this when we're talking about diabetes management. All right? So sugar, glucose, comes from the food that we eat, or, so we have food that we eat, and it also is made by the liver. Yes, if you have not watched my podcast episode on the liver, you should check it out because I talk about the benefits of the liver, if we can do without livers. And yeah, so one of the things that the liver does is to produce sugar, blood sugar or glucose. Alright, so you can get blood sugar from the food that you eat, alright, or is made by your liver. Alright, and it's very, very important, as I said, to mention this because you need sugar, you need glucose in your body. All right? So a lot of people want to know, okay, I've been diagnosed with type 2 diabetes. What do I do now? This is a hard blow for me. A lot of people, their heart breaks. They're just miserable once they receive that diagnosis. They're like shocked. They face denial. They go through the stages of the denial, the acceptance, and all that. So they want to know, oh my God, I have diabetes. What do I do now? What steps do I take to manage my blood sugar, prevent serious complications, and continue living a normal, productive life? Because trust me, if your sugar, blood glucose levels is not controlled well, if you're not controlling your diabetes well, you may end up having a lot of complications, and that is not good. All right, so we're going to talk about steps that you can take to manage your blood sugar, prevent serious complications, and live a pretty much healthy life and a normal life. All right, so we want to first talk about why your blood sugars, or what makes your blood sugar or blood glucose elevated. what happens? All right. So the term for elevated blood sugar or blood glucose is hyperglycemia. Hyper means high, hypo means low. So we say hypoglycemia for low sugar levels, and we say hyperglycemia for high sugar levels. So let's repeat that. Hyperglycemia for high blood glucose levels, or hypo for low blood sugar, blood glucose levels. All right. And when you have hyper, meaning when you have too much blood sugar, this may be caused by too little insulin, or when the body cannot use your insulin properly. And so if you have too little insulin, remember that insulin is a hormone that regulates, your levels. So if you have little insulin, or the body cannot use the insulin properly, then you may end up having hyperglycemia, which is a high sugar level, blood sugar level. All right. So there are things that could cause hyperglycemia. We have not being active, sedentary lifestyle, being obese or overweight, not having enough insulin, like I mentioned before, or oral diabetes medication. And hyperglycemia could also be caused by the side effects of other medications. So a lot of people do not technically have type 2 diabetes, but because they take other medications like steroids or antipsychotic medications, their blood sugar goes off the roof. All right. So yeah, it could be a side effect of the medications that you're taking, like steroids and some other medication. And then if you're taking off those medications, your blood sugar tends to return back to normal. So some people have hypoglycemia, which is high sugar levels from the side effects of other medications such as steroids. That is very, very common. And you see that too when people are hospitalized. Then they go to the hospital and they're put on steroids to manage one of their other ailments or diseases or conditions, and then the sugar shoots higher. All right. And then we have high glucose levels from stress, illnesses, even pain. If you have long-term or short-term pain, it could increase your sugar levels. Trust me, some people have hyperglycemia from a lot of things. So yeah, you could have it from stress, you can have it from pain, you could have it from illnesses, as I mentioned, some medications that you're taking, not being active, sedentary lifestyle, not having enough insulin, or taking enough oral medications, diabetes medication, being dehydrated. If you're dehydrated, your sugar levels may go up. And then the last one is eating too much. All right, because remember I said that a lot of foods that we eat convert into sugar. So if you eat too much, if you eat a lot of meals with more carbohydrates than usual, if you eat a lot of food, a lot of carbs, because carbs convert into sugar. So yes, those can cause hyperglycemia, which is a high level of blood glucose, all right, or blood sugar. All right, so the good thing is that even though you may have high blood sugar or hypoglycemia, you can always do a lot of things that could bring your levels down. You can take care of yourself, and you can learn how to control your hypoglycemia. All right, as I mentioned before, if you're taking certain medications, sometimes when you stop the medications, your levels tend to go back to normal. Or if you have to be on the medication for long term, then your doctors or your healthcare team might decide on what they want to do so that you regulate your blood sugar as well. All right. So now we're going to talk about hypoglycemia. Hypoglycemia is when your blood sugar is low. All right, blood sugar, blood glucose, all right, is low. All right, so it's going to be the opposite of hyper. All right, so not having enough food, if you have too much insulin, or you take too much oral medications, diabetes medication, and it could also be a side effect of other medications. Yes, just like we have hyperglycemia, you have hypoglycemia, so it could be the side effect of other medications. If you do too much exercise activities, you exercise more than usual, all right? And then if you don't eat enough food, yeah, so if you eat very little food that has low carbs, that you're missing meals, you skip meals. All right, that's why it says don't skip meals, don't miss your meals. All right, yeah, or if you skip snacks, you can have hypoglycemia, which is low levels of blood sugar or blood glucose. All right, and then the same thing for hyperglycemia. There are things that you could do to avoid being low. So we'll talk about that. All right, before we continue, we definitely need to talk about hemoglobin A1C. Yes, a lot of people know it as A1C. A1C, you hear A1C when you go to the doctor's office, or you talk to people and you tell people that you have type 2 diabetes or you have diabetes. They want to know, oh, do you know what your A1C is? What is the A1C? So A1C is very important, very, very important in the management of type 2 diabetes, or type 2 diabetes in, generally speaking. So you want to know what your A1C is. It's a blood test that you do. It's a 3 months average of your sugar levels, and it tells you how well your diabetes is being managed. Okay, so A1C is very important when you talk about diabetes management. It tells you it's a 3 months average, as I said before. It just tells you how well your diabetes is being controlled, and it's important that you know what your numbers are. And so you should have this blood test done. All right, and actually this is a blood test also that you can have done to make that diagnosis of diabetes. All right, so as I mentioned before, if you have an A1C of below 5.7, you are considered not to be diabetic. And then if you have 5.7 to 6.4, you are considered to be pre-diabetic. And then if you have an A1C of over 6.5, then you're considered to have diabetes. All right, so that is just a rough summary of how to get diagnosed with diabetes. All right, we do have different types of diabetes, by the way, but we're focusing on this episode, I'm focusing on type 2 diabetes. We have type 1 diabetes, as I mentioned earlier. We have gestational diabetes, which is for the pregnant people, women. But we are focusing on type 2 diabetes today. So as I said before, type A1C is very important in diabetes management. It's a simple blood test that you do. You can do it with your other blood tests that the doctor sends you in for to get done. And as I said, it gives you a picture of how well your sugar levels has been controlled over the past 3 months. All right, average level over the past 3 months. The higher the levels, the greater the risk of developing diabetes complications. Remember that. All right, the lower the better. We do not want your numbers to be high. If you have lower levels, you are at lower risk of complications. If you have higher numbers, all right, you are at higher level of increased risk of having diabetes complication. So the goal is that we want to keep your A1C below 7, all right, and even better still below 6.5, all right. But we want your A1C if you have diabetes. That's what I'm saying. If you have diabetes, if you're confirmed to have type 2 diabetes, you want your A1C to always be low, all right, because if your A1C is high, that means that your sugars are not controlled well, and you have a risk of having complications, as I mentioned before. So you want your A1C to always be below 7, or better still below 6.5, all right. So your healthcare provider, your primary care provider, will tell you how well you're doing in terms of your diabetes management, how often you should get the A1C test done. A lot of people get it done every 3 months. They just know that's the routine. They go in for their blood test and they get their test done every 3 months, while some people do it every 6 months and some people do it yearly. I guess it just depends on how well your sugars are and how well you're controlling your diabetes and where you are, pertaining to your diabetes management. All right, so your primary care provider or your specialist, which is also called an endocrinologist, which is a diabetes doctor, will tell you how often you need the A1C test done. But I said before, a lot of people get it done at least twice a year, and some people every 3 months. All right, okay, so that is about A1C. All right, so I hope that this helps. So now we talk about blood sugar. We want to talk about blood sugar. Some people, their primary care physician or their healthcare team will tell them to monitor their blood sugars at home and make sure that it's controlled at home. So apart from the A1C, which is the blood test that is done by the lab, you can get to monitor your blood glucose at home. All right, so some people do, they give them the machine, they give them the equipment that they need, the lancets, the strips, and all that. They give them the devices that they need, the blood glucose monitor, and they tell them to go home, and they will tell them check your sugar so times a day, maybe fasting, maybe 3 times a day, maybe before meals, maybe after meals, and at bedtime. They will tell you all that. Where some people, the sugar is controlled to the point that they don't need to be checking their sugars at home, so they do not have the device at home. But so yeah, it depends on what you and your primary care physician has talked about, discussed about your diabetes management and how you should proceed. So yes, some people are sent home with the devices to monitor their blood sugar at home or blood glucose levels. All right, so as I said before, this is something that it depends on how well your diabetes is going, the management of your diabetes is going. Some people have very, very high levels of blood sugar, and it's really poorly controlled, and they have to monitor at home. All right, and some people, it's very good, they're controlled well, and they don't have to do this. Okay. So the reason why you have to be very careful when you have type 2 diabetes is because it can lead to a lot of complications, and you do not want that to happen. If your blood sugar levels are high, you are at risk of having complications from diabetes. And we've talked about complications before, but I'll mention it again. Complications, diabetes affects a lot of things, a lot of organs in your system when you have uncontrolled diabetes or poorly controlled diabetes. So it can affect your eyes, it can affect your kidneys, it can affect your heart, it can affect your nerves. All right, so we do have things that your organs that are very important to you that diabetes can just damage, all right, due to high sugar levels. So you definitely want to avoid that. All right, and then when you do have to check your sugars at home, have a log so that you can log in your readings. All right, some people have a glucometer that has a memory, and you can store their numbers that way. But just in case of technical malfunction or anything like that, have a log, that you write your dates, the times that you take your blood sugars, and you write your numbers down. And that way, when you go for your doctor's appointment, you can always show the doctor, hey, these are my numbers for the last week, these are my numbers for the last month, these are my numbers for the last 3 months, depending on how often you see your doctor. All right. Okay, so it's very important, very, very vital that you log in your results and you bring it to your healthcare provider the next time you see them. All right. Also, if you do need to have a educator, a dietitian to work with you in terms of what type of diet you should be having, what types of things you should be eating and avoiding, you definitely have to talk to your healthcare provider about that to get the appropriate referral. All right. There's nothing to be ashamed about. If you do not know what types of food you should be avoiding or eating, it's good for you to see a dietitian or a nutritionist or a diabetic educator that will be able to walk you through, have a care plan for you, and discuss all these things for you. All right. Okay, so as I said before, who should check their sugar levels? Who should check the blood glucose? Yes, when you do talk to your healthcare provider, you make that decision. But definitely, these people, they need to monitor their sugar levels at home because it's important for them. So people on insulin. So we do have different types of treatment for diabetes. All right, we do have different types of treatment. We have oral medication, which is the pills that you put in your mouth. All right, and then we have insulin. So we have insulin, and we have different injections as well that have come up, right? Okay, so we have Trulicity, which is a kind of like an injection, but it's not insulin. Actually, it's not insulin, but you give yourself, shots. And then we have insulin, And then we have long-acting insulin, short-acting insulin. We have Lantus, we have Humalog, we have Novolog. We have different types of insulins, and we don't want to go into all that today. But then we have the oral medication. So if you're taking insulin, you should be checking your blood glucose levels. All right. Well, it's going to be beneficial for you rather to be checking your blood glucose regularly if you take insulin. And of course, if you're pregnant, some people have type 2 diabetes and they're pregnant. So it's different from them having gestational diabetes, meaning that when they're pregnant, they have diabetes. So some people already have diabetes. And some people, when they have gestational diabetes, it increases their risk of having type 2 diabetes after their pregnancy, if that makes sense. So if you're pregnant, if you're taking insulin, definitely, if you have a hard time controlling your blood glucose or blood sugar levels, you should probably be monitoring your sugar levels at home. And then if you have highs, if you have lows, if you have sporadic readings of your blood sugar, you may be benefiting from checking your blood glucose or blood sugar levels at home. All right? So as I said, they give you a glucometer. There are different devices out there now. Some people don't even have to poke themselves anymore because some people do not like that feeling of getting poked every single day. So some people have devices that you can just that takes your blood sugar levels and stores it into a device for you. It's very easy. You don't have to poke yourself. So yeah, that is there are ways that you can do that. You just have to talk to your healthcare provider to determine what type of devices are you're eligible for, and based on your insurance, you may be covered. Right? So as I said, we do want your A1C levels to be low, and A1C targets differ based on your age and health. So we want A1C to be less than 7, as I mentioned before. So and then we want it to be between 80 and 130 for your glucose level, before a meal. And then we want it to be below 180 2 hours after a meal. All right, so 1 to 2 hours after a meal, less than 180. And then before a meal, we want it to be between 80 and 130. So I always tell people, fasting levels, fasting means that you've not eaten, you've not had anything to drink, you've not done anything, you wake up, then the first thing you do is check your sugar. We want it to be lower than 130. All right, so ideally between 80 and 130 for fasting levels. All right, so we want it to be lower than 130 when you check your sugar. And then if you eat 1 to 2 hours after you begin your meal, we want it to be less than 180. But as I said, each person is different. Your plan may be different from my plan. Your friend's plan may be different from another friend's plan. So you have to work together with your healthcare provider to determine the best plan for you in terms of your diabetes management. So where I am in my diabetes management might be different from where you are. We cannot say everybody has to be the same. What my A1C should be for me might be different from what your A1C should be for you. So there's a whole picture here that your healthcare provider will take into consideration. You have to take your comorbidities into consideration, your overall health into consideration, and how your diabetes is being managed. So, but generally speaking, you want the A1C to be less than 7, as I said, and then your sugar levels, when you check your blood glucose levels before meals, fasting, less than 130 ideally, between 80 and 130, and then a couple of hours after meal, you want it to be less than 180. And then I want to bring up the fasting. So fasting is, as I said before, not eating, not drinking, not doing anything. First thing you do in the morning. But then a lot of people end up having high numbers in the mornings, and they don't know why their sugar levels are high in the mornings when you check their sugars at home. So I tell people that fasting is a good indicator of how well your sugar is controlled, and of course the A1C. But you need to know how to check your fasting, or when to check your fasting levels. You need to know when to check your fasting. So your fasting levels have to be done without food, without drinks or anything, coffee, tea, nothing, all right? And then it has to be at least 8 hours from the last time you ate. So you cannot be eating in the middle of the night and intend to take your blood sugar fasting in the morning. So for example, you cannot snack on food around 2 a.m. and end up checking your sugar in the morning at 5. No, that is not an accurate reading at all. It will make your sugar levels high. All right, it will make your sugar levels high. So you need to be careful of when you time yourself to take your fasting blood glucose levels. You have to wait at least 8 hours after you had a meal or snack or drink or whatever. All right, so for example, if you eat at 10 p.m., which is not even ideal, you shouldn't be eating that late, but let's just give an example. If you eat at 10 p.m. the night before and you test at 7 a.m. In the morning, that's 9 hours, all right? Or 8 a.m., whatever the case may be, before you have breakfast. That's way over, 8 hours, all right? So you want to do at least 8 hours from the last time you ate. So 9 p.m., then you want to do at least 8 hours after to check your fasting levels, and that way you might be able to have a better indication of how well your sugar is or what you've been doing. So if you've been eating bad, eating junk food, eating too much carbs, then you will see that result in your fasting levels, all right? And we want it to be lower than 130 ideally. All right, so yes, so that is what it means. So as I said before, when you check your blood sugar, have it logged in and show it to your healthcare provider when you go for your appointments, and they'll be able to guide you, right, and tell you if you're doing a good job or not. And then you do your A1C, which is a 3-month average, and you'll be able to know how well your blood sugar is being controlled as well. So yes, so talk to your healthcare provider, talk to your endocrinologist, who is the diabetes doctor, regarding managing your diabetes well, if you should be checking your blood glucose levels at home or blood sugar levels at home, and if yes, how often you should be checking it and when you should be checking it. All right, so as I said before, you definitely want to lower your sugar levels, because if you don't, you have a risk of complications, diabetes complications, and it could just make life more miserable for you. All right, so yes, so we did talk about A1C, hemoglobin A1C. We talked about hypoglycemia, which is lower blood sugar levels, and we talked about hyperglycemia, which is high blood sugar levels, and we did talk briefly about what type 2 diabetes is and why it's important for you to manage your type 2 diabetes very well. All right, so I hope this helps, and if you have any questions or concerns, you can always let me know, and I will catch you in the next one. Take care. Bye bye.